I'm Dr. Mike LeNoir, and this is the Wellness Watch. Good health and welcome to today's edition of Wellness Watch, sponsored by the African American Wellness Project and BlackDoctor.org. I'm your host, Dr. Mike LeNoir. Today, a very important program. I want to talk about vaccinating your children for COVID-19 infection. We all know that most parents are hesitant about giving children this vaccine. We understand your hesitancy. Today, we have two parents who share your similar concerns. They're going to ask questions of our experts here. See if we can get some answers that can clear up some of the issues you might be concerned about. Last week in Southern Africa, a different form of the virus was described, a variant called Omicron. What makes this important to you as parents is this virus not only has predilection for adults, but also for children under the age of 5. That makes your decision about getting your children vaccinated all that more important. Our experts today include Dr. Oliver Brooks. Dr. Brooks is a pediatrician, past president of the National Medical Association, and serves on one of the most important committees in the state of California on all things having to do with vaccinations for COVID-19. And the go-to physician here at the African American Wellness Project for all things pediatric is Dr. Donna Carey. Moderator for our program is Ms. Kim Scott. She's a nurse, a lecturer, a teacher. She'll be leading the discussion. And now, Ms. Scott.
Greetings. Tonight, we're here to talk about a very important topic. We're going to discuss COVID-19 vaccine hesitancy among African American parents. We will be speaking to Mrs. Monique Pittman, Dr. Chandra Holsley. Let us know what process you went through to make a decision whether you were going to have your children vaccinated or not against COVID-19.
We actually have two children in separate age ranges. One is 8 and one is 13. So initially, our 8-year-old wasn't of age to get the vaccination. But once it became available for the group of, I believe it's 12 and up, Savannah, I just talked to my husband. We talked about it. He had some concerns. Initially, he was saying that, we wanted to wait a couple of weeks or whatnot. But I was able to convince him to allow her to be an early adopter and go ahead and get it. So we made an appointment and I took her down there and she received her vaccination. And then we went back for the second dose. So it was really, no issue. It was something that we were going to do once it became available for her age range.
So I have two sons, ages 15 and age 11. And I, like Shonda, was not 100% sold on the vaccination when it first came out. I had a lot of concerns about the side effects and the long-term effects. But after talking to my dad, I felt a lot more confident about moving forward with getting the vaccine because I felt like the risk of not getting the vaccine, the risks of not doing that were far greater than actually getting the vaccine. So my oldest son got vaccinated as soon as he was able to. He's age 15. My younger son, who's age 11, is not old enough yet to get it, but I do believe when he is of age, he will get it, although I still do have some concerns with the fact that he's a lot smaller, he's younger, and I know that they're still doing a lot of studies around whether or not younger kids should actually get it, but more than likely, like I said, I will get it, but I am a little bit concerned and also hesitant. I know he won't be the first one to get it when it rolls out for his age group.
The vaccine was initially made for just adults. And now there's a decision to vaccinate children. So what are the current recommendations for vaccinating children and why are we vaccinating them now?
Okay, so the current recommendation is as of November 2nd, which per this recording is today, the vaccination is recommended for all children ages 5 on up. So generally, we cut off children at 17. So 5 to 17. The decision today was to expand the recommendation from 12 to 17 now to 5 to 11, and they're 12 to 17. So everyone 5 years and up. And it is really important that children get vaccinated for a number of reasons. Number one, children are a reservoir of infection. So they don't tend to get that sick or have that many issues with COVID-19 if they get it, but they can certainly give it to other people like grandma or father, mother, teacher, and those people will have a harder time. Number two, there have been 1.9 million cases of COVID-19 in the 5 to 11 age group, 8,300 hospitalizations, and about 94 deaths. So there is death, hospitalization, and sickness in children. And lastly, the only way we're going to get to the other side of this is to have everyone that can be vaccinated. So then the virus doesn't spread as much. We get less disease. The case rates go down. We get less variants. One final thing I guess I will add too is kids need to go to school. If you test COVID positive, you can't go to school. You can give it to your classmates. You can give it to the teacher. Children need to go to school so their mothers can work so they can learn. So there are a number of reasons why, and I will also add the vaccine is safe and effective. So for those that are concerned about that aspect of it, the vaccine is safe and effective for anyone 5 years of age and up.
Thank you, Dr. Brooks. You listed some very important reasons why we should vaccinate children. Not only, we know that generally they don't get as sick, however, but it's the people that they come in contact with that can be an outcome of particularly death for a grandparent or either a teacher. And we've seen that happen across the country. Very important. And they need to go to school. I'm a parent myself, and I know what a big difference, or actually what a burden has been to have your kids at home and not be in school. So thank you for those very important reasons why we should vaccinate our children. This next question is for Dr. Donna Carey. Dr. Carey, there's a perception that the vaccine was made too quickly. Can you speak on that for us?
So there were three main reasons why the vaccine was developed so quickly. Number one reason is because we had decades worth of knowledge about coronavirus, the actual virus that causes this particular pandemic. We had a previous experience with it back in 2003 with our SARS outbreak. But at that time, scientists didn't have enough people infected to complete the vaccine process. So because of the studies, they knew exactly what to target on this virus to be able to infect people and to be able to stop it and create a vaccine. So that was the first step. We knew exactly what to target on the virus to prevent infection. The second thing is that because this was a worldwide pandemic, there were many countries who put in resources, time, energy, and money into creating this vaccine. So it wasn't an issue of stopping with each phase and attempting to find the money and the resources to go into the next phase. For this particular vaccine, we were able to combine and do phases 1 and 2 and 3 at the same time without having to be concerned about the finances of the vaccine. And then finally, we were able to cut some of the bureaucracy out of going through the process of getting the vaccine cleared. So because of those three reasons, we were able to get the vaccine at record speed.
Next question is for Dr. Oliver. So we've heard about vaccines for, going on 2 years now. What exactly is a vaccine?
Okay, so a vaccine is a compound, simply speaking, that stimulates an immune response. So I liken it to a picture of a robber. So I show you a picture of a robber. Now this picture cannot do anything to you. It can't infect you. But what it can do is it alert you to the fact that this is who you need to be looking out for. So if this robber comes knocking on your door, you see him walking around in your neighborhood, you call the cops and you say, this is a bad guy. We know it. Take care of this. So A vaccine stimulates an immune response, which are basically what most people hear about are antibodies, but there are also other parts of an immune response. So therefore, they are a sentry at the door of your body. And if the particular infection's agent for which the vaccine was developed shows up, your body is already ready. So it gets in and your body says, I'm ready for you, and it kills it, basically. Without a vaccine, your body has no idea what's really going on until it's too late. Your body does ultimately mount a response, but it's after this robber has been all through your house, or after this virus has been into your lungs and your heart and your kidneys and has already done its damage. And then your body responds and it's gone, but the damage is done. So it is really important that people understand how vaccines work by priming your body to be able to respond to an infection and thereby protecting you from a potentially deadly infection.
Thank you, Dr. Brooks. I think that's the best analogy or illustration that I've ever heard of what a vaccine is. We've seen the news, we've heard, been on so many Zooms, but that was a great job. Really helps to stick in my mind, that recognition, that picture of the robber, right? There's recognition that our body identifies and recognizes this is an enemy, and that our body, mounts a response and the antibodies fight that virus. So thank you so much for that. Now, the flip side to that is, okay, I decide I get this vaccine. Another huge concern for many people are, what are the side effects of the vaccine?
Every medication, every vaccine, every medical treatment has potential side effects. Yeah. So in this particular case, it is also the case. So the primary side effects are, as we look at them for vaccines, they're called local reactions and then systemic reactions. So local means, here's my shot. I get redness, swelling, and pain at the shot site. That is common. To me, I say that means the vaccine is working. If you inject it and absolutely nothing happens, then you're almost wondering if you get a response. You're supposed to get a response. The body was injected with something that says, I need to react. Systemic side effects are fever, headache, fatigue, things like that. There are other rare side effects, particularly with the COVID-19. We've seen a higher incidence in young males, basically aged, let's say 12 to 30, of a rare event called myocarditis, which is inflammation of the heart. I think it's important for people to hear this because it's out there in the ether. But importantly, the chance of getting myocarditis is low, number one. Number two, if you get myocarditis, there have been no deaths related to it. And then number three, probably most importantly, is that your risk of getting myocarditis, which is inflammation of the heart, is higher than in people that get COVID, the disease, versus people that get the vaccine. So if you're worried about having some problem with your heart from the vaccine, I would tell you, no, you need to worry about something bad happening to your heart if you get COVID-19. And people that get COVID-19 inflammation of the heart end up being hospitalized in the intensive care unit and dying. The few that got it from the vaccine were in the hospital for an average of 1 day and went home and were fine. So there are side effects, that is true. But the bottom line is the benefits far outweigh the risks of the vaccine.
Thank you, Dr. Brooks. That is so true. I know in some of the conversations I've had with some of my peers or people, will say, there are all these side effects. And it's so true that you could take a Tylenol. You could take something. We don't know what our body is going to do if we take something, which is so true. So it could be so simple as a Tylenol. And that's very important. I just got my flu shot yesterday. And, all those signs that you said are common side effects that can potentially happen. I want to talk about some of the myths, right? So we know these myths that we hear prevent people. They're really serious. They prevent people from making informed decision or making the right decision because misinformation. So I want to ask about some myths, and this for you and Dr. Carey. One is, if I get the vaccine, will it give me COVID-19? Another one is, does it cause infertility? And another one is, does the vaccine kill you? Can you die from getting the vaccine?
Dr. Carey, please.
Sure. So the first one is, does getting the vaccine give you COVID? And the answer simply is no. There is no virus that is within the vaccine. So the vaccine is preventing COVID. It does not give you any part of the coronavirus within the vaccine. The second one is it have issues with that cause infertility? And I understand that as a mother. I have a teenage girl who, I definitely don't want her to have any issues with wanting to conceive when she's ready, which better not be now. But when she is ready, I definitely don't want her to have any issues with that. But there is actually no evidence that it has any issues with infertility. The way that the vaccine works does not interfere with the same pathways it works in terms of the process of being able to have a baby. So that's number two, as well as the American College of Obstetrics and Gynecology and the American College of Neonatal Medicine all agree that you should vaccinate pregnant women. And then finally, do people die from vaccines, from this particular vaccine? And I would say very similar to what Dr. Brooks said about side effects. You can never say never, and you can never say no 100%, because everyone will react differently. But the majority of people have tolerated this vaccine without any major issues. And if you look at the number of people, first of all, there's never been any vaccine associated deaths that they can link directly to the vaccine. But there are people who may have had a significant reaction to the vaccine, and that may have contributed to their death, along with maybe having other medical issues. But just as there are car accidents and we still drive our cars, where people go to amusement parks and have these fluke accidents on roller coasters, yet we still ride our roller coasters, there should be the risks of a serious side effect from this vaccine is so low that you would want to take the risk of taking the vaccine versus the risk of getting the virus itself and having it cause long-term damage in your body.
Thank you, Dr. Carey. Those are very important points to make. So next question for Dr. Brooks is about the booster for children. So right now we know that we as adults are getting the booster shot. Do you think that children will need a booster?
That's a very interesting question. I don't know. I mean, the short answer is, and we don't know. I mean, and we're using the term children loosely. So right now, literally the recommendation today was 5 to 11-year-olds should get vaccinated. But back in May, 12 to 16-year-olds were recommended to get vaccinated too. So they're technically still children. And then we'll talk to 15. So 16 on up could get Pfizer, 18 on up could get J&J vaccine or Moderna vaccine. It's interesting. Children respond to vaccines at a far greater or better, to me, rate than adults and certainly seniors. So if there will be a need for a booster, it will be not like adults, because adults, their immunity wanes. And I would presume that children's immunity will wane also, but children respond. The studies showed that even compared to 16 to 25-year-olds, these 5 to 11-year-olds had almost 1.5 to 2 times the response of even these younger children, which is higher than older adults. So at some point, my guess is children will likely need to get a booster. But what we will do, we are doing, is monitoring their immune response over time. And we will see if their immunity drops, if we see more cases as the children get further and further months out from their vaccines, then we'll get there. But I think step one right now, and this is actually really important, beyond boosters and almost beyond the children, we need everyone to get vaccinated. So I'm more interested in that percent of the African-American population and the general population who is unvaccinated to get vaccinated versus those that are fully vaccinated to actually get a booster.
Dr. Carey, this last question for you is, should pregnant mothers get vaccinated?
Absolutely. So if you are pregnant, you definitely want to protect yourself from getting coronavirus. We have seen cases. I personally have treated cases where the mother is pregnant, got infected with coronavirus. And as we know, coronavirus likes to attack the lungs. And this particular mom had difficulty breathing. And so we needed to take her baby out early so that that could free up the space for her lungs to actually expand and allow her to breathe. And that caused, of course, difficulties with the newborn who wasn't ready to come out, was born premature, and for the mother in her recovery. So we definitely want to prevent that from happening. And the way that we can help to do that is by vaccinating all of our pregnant moms.
Thank you, Dr. Carey. It is crucial that pregnant mothers get vaccinated because it doesn't just affect them, it affects their unborn child.
Absolutely, yes.
Thank you so much. We will take a short break. And when we come back, we're going to talk about the mandate, hear from the parents and what their thoughts are about that.
I'm Delroy Lindo, and I had the coronavirus. So I know from personal experience how devastating a coronavirus infection can be. Now, fortunately, I fully recovered, but I don't want anyone to experience what I went through. We're living in very dangerous times. On many levels, our communities are under siege, under attack. You know it, and I know it. Now, in the face of that, we need help and support each other wherever and whenever we can. One of the ways we do that is to get vaccinated against the coronavirus. That protects you, your friends, and your loved ones. With everything we're facing in today's environment, please get vaccinated. Ensure that our communities remain strong, healthy, and well.
All right. I want to hear from the parents and what their thoughts are about the mandate, and they're having their children having to be vaccinated or else. Monique and Shonda, can you weigh in? Tell me what you think about if children are going to be, or the mandate, if their children have to get vaccinated. Monique, you're muted.
So for me, I do have a little bit of a concern for my younger son because he has a lot of pre-existing conditions and especially really bad asthma and allergies. And I know that I've heard everything that you've said, and I know the vaccine is the safer route, but I still have a lot of concerns before I actually get him vaccinated. So when it comes to mandates, I don't feel like parents should be mandated to get their children vaccinated. As a parent, you should be able to, you should proceed however you want to proceed when it comes to your child. And I just don't think that it should be mandated across the board, although I do think people are safer by being vaccinated. So I don't know if that answers your question. It's really a dichotomy for me because I struggle from both sides.
Absolutely. That's totally understandable that to not have the right, right? It's when you don't have the right to choose and you have to do something that changes it. Totally understand that, Monique. It's real. Shonda, what are your thoughts?
I think that I'm a little bit more open to a mandate. And it's because, so for instance, I did not have the chickenpox vaccination when I was growing up. I was exposed to chickenpox, a lot of my siblings, people in my neighborhood was, and we were fine. But then once the varicella vaccination came along and I had children, I was fine with them getting it. So, I just look at it as another vaccination. I feel like this vaccine has been politicized, and I think that factors into just some of the issues that we have. But I believe that a mandate will help us to curb this virus. And so I'm actually in favor of it. I mean, of course, parents have the right to opt out, as with any vaccination. But I do believe that a mandate for children and adults will help us get a better handle on this condition.
Yeah, Shonda, you make a great point in regards to the pandemic being so politicized, where, there's so many moments that you hear, politics getting in front of science, like things that we know work, things that, we've had our vaccinations and gone to school and just how they evolve. I'm a parent as well. My daughter, there wasn't an HPV, vaccine. She just got vaccinated.
Yeah.
Like, we know that vaccines get rid of, diseases that kill. So it's the right thing to do. The being mandated and being required, I think that they possibly, kind of, it complicates things when you don't have that choice, but we know that vaccines work and they save lives.
And that's
Absolutely
as well, because I know that, and I know that by having a mandate, it would make us safer. But when it comes to your kids, you also always worry. And so, there's just two sides to it. And it's not an easy question to answer especially when it comes to your kids.
Agreed. Yeah, the mandate is serious, people are losing their jobs because of they haven't gotten vaccinated. It's very real. I want to open this up to our experts and hear what their ideas are, weigh in regards to the mandate. Dr. Carrier, Dr. Brooks, what are your thoughts?
Yeah. So again, as a mother, I completely understand parents' hesitation to wanting to get a new vaccine, right? I think about my mother in the 70s having to make that very same choice for whether or not I got measles, mumps, and rubella, because it was a relatively new vaccine. But the key here is that vaccine mandates are not new in pediatrics. We do have plenty of, in California at least, plenty of vaccines that say, it's not mandatory for you to get your child the HPV vaccine to come to school, because that is really, affects an individual person. But when you talk about something that is easily spread to other children, that is potentially deadly, then that's where mandates come into play. So all of the vaccines that are mandated because the personal choice that a parent might have for their individual child puts another child who did not make that choice in jeopardy. And whenever we have that situation, that is when it is important to do things like mandates. Nobody likes to be told what to do. We parents don't like to be told what to do about our children. But to keep other children safe, you have to be able to say, you can't be in this environment where there's other people around when you could potentially have a disease that spreads that could then infect someone else and really impact their lives. And that's where the mandates come into play.
That's an excellent point. Dr. Brooks, what do you think about that?
Yeah, I'm really torn regarding mandates. Simple statement is that mandates end up getting more people vaccinated, some more children vaccinated, so they generally are effective. The other side of that is that this is an emergency use authorization if we're speaking about the 5 to 11 years of age. So I'm a little leery of mandating a vaccine that is under emergency use authorization, especially for children. So I can see both sides. I think that there's another part right now. The rate of COVID-19 infection, at least up until a couple of days ago, was diminishing, was dropping. So we were moving almost kind of out of the need for emergency operations. There are a lot of things that go into play when you start looking at a mandate for a child. Dr. Carey made some excellent points about it's infectious in nature, like this is, versus, let's say, HPV, which is not, and it's a personal choice, non-infection that way. Hepatitis B, same way. So I would say that I would feel uncomfortable determining there be a mandate today, the same day that the vaccine was recommended by the ACIP. But I would like to see what happens in the next 30 to 60 days. If we're getting ready we're in the fall, heading into the winter months where we have higher incidence of respiratory viral infections. And we will have another couple of months we have months of evidence of a vaccine being recommended to the 28 million children that are 5 to 11. So give me 60 days of information and then ask me then.
Okay.
Yes,
Fair-
and I
fair
agree
enough.
with that. Can I just say, I totally agree with that. The mandate that I would say we are safe to put into play is the 12 and up, because that is in a full authorized use. In the emergency use, I totally agree with Dr. Brooks that we need to wait and see before we mandate for that age group.
Okay, so we need more data. We need more information to maybe move towards a mandate for this population for kids under 12. Okay. All right. Well, as we close out, I want to ask, what can we do to get more African American parents to be less hesitant, to have more confidence in vaccinating their children? Parents and experts can weigh in. This question is for everyone on the panel this evening. What do you think we can do to increase the confidence among African American parents in getting their children vaccinated for COVID-19?
I'll start.
Go ahead, Sean.
Yeah, I was actually I'm from Los Angeles, and I was just in Los Angeles last weekend, and I met with my nephew, and I just assumed that he was vaccinated, and he is not. And I asked why, and he said, "Auntie, I don't trust the government." And I hear that a lot in our community. So I just think that, and also I'm a member of Jack and Jill, and one of my fellow Jack and Jill moms, I just made the assumption that she was vaccinated, and she was not. And so I think, one, we can't make the assumption that everyone thinks like us and that they're vaccinated. And we need to have some grace and maybe have some small groups, opportunities for people to talk and discuss their concerns and be empathetic. But those are real concerns. He said, "I don't trust the government." And I'm sure that there's a lot of things that come with that, but just really meet them where they are and address those needs. And those questions. And with my Jack and Jill fellow mom, I saw her a month later, and she had gotten vaccinated. And so, I just think that just continuing to talk about the importance of vaccinations and the importance of getting our kids, vaccinated and helping the entire community is helpful. And we just need to be empathetic and persistent and consistent. So those are my thoughts about it.
Thank you, Shonda. Grace and patience.
Absolutely.
And Shonda, you basically said what I was going to say. I think, the African American Wellness Project, I know the mission is to really inform the African American community as a trusted source. And I think that's what needs to happen. More dialogue like this, more forums where parents can ask questions, and just more data and more statistics to debunk a lot of the myths that are out there about the vaccination would probably make a lot of people feel more comfortable with getting it once they hear from more experts and are able to ask their questions like we were able to do so today.
Thank you, Monique. Agreed.
Yeah, I agree. When this vaccine first came out, we started talking about vaccine hesitancy. I hated that phrase. So I started using a phrase that I coined called justified distrust, right? Because within the Black and Brown community, the medical and scientific history that we have, and the misuse and abuse of Black and Brown bodies that dates back pre-slavery, that it's justified that we would not trust a vaccine that was created really quickly with a virus that was relatively new, that not a lot of people had heard about, in record-breaking time. If you didn't have questions, and you don't have questions, then I'm concerned about you. And so I think we need to take time to talk to people, to explain it to them clearly, to hear what it is that they are concerned about, and then to answer those questions as best we can.
Agreed. Thank you, Dr. Carey. Dr. Brooks.
Yeah, so what Dr. Carey said is more important than I think we understood. When you see one justified mistrust individual, you've seen one. So everyone has a slightly different reason why they don't want to get vaccinated. Monique said that mistrust of the government. Was that you, Monique, or Chanda?
No, that was my nephew.
Chanda. Okay, yeah. So here, what it really comes down to is fear. There's a general fear of getting vaccinated, and they come up with 100 different ways to say fear. So you have to understand it is an emotional and not a scientific or objective response. We all have some mistrust of the government. We should in this country, based on the 400 years, plus years of history African Americans have in the United States. But they have to not mistrust me or Dr. Carey, Dr. Halsey, or Dr. LeNoir. So I feel we need to speak from a personal experience and speak to, as best you can do, to speak to their heart. Skip the brain. You can do, well, okay, start with the brain, but end in the heart, because their real issue is something that they feel here and not here. And there's no simple answer, but if you think about it from that perspective and start with that as your approach, then I think you will reach people. I think as a challenge, as a pediatrician, mothers are very protective of their children. So you got to get through that mother first. I mean, once she makes it in the other side, once the mother makes the decision, that's it. So the child may fuss and fight, but once mom says it's going to happen, it's going to happen. So I, as a pediatrician, really address what that mother's true fear is. Let them know that I've done the research. Past president, National Medical Association, National Medical Associations done the research. California State has done the research. Everyone I know has done the research, and we believe it. So I think when you just take all that into account when you approach this parent, then hopefully you'll get through. And the last thing I say is be patient. There was just, I think what Sean just said, someone finally got vaccinated. I had an employee at work who's been holding out for months. She got vaccinated yesterday. Said she had a terrible reaction. I said, well, you know what? Think about what your reaction would be if you were in an ICU with COVID. So I think that patience is also important.
Wow, that's big. I heard a lot of things that really just hit the core. The patience, the assumptions. Shonda, like you, I have young male cousins who, they came to the house. I wanted to, love on them, and I assumed that they were vaccinated, but they weren't, and very similar reasons. I don't know what they're trying to do to us. They're trying to get rid of us. They don't care about us, right? Yep. And really, the bottom line is it's fear of the unknown. Mm-hmm. And Dr. Carey, for a fact, we were guinea pigs, and that's really real, that we have to acknowledge that it did. Vaccines were used to cause harm. And we have to acknowledge that and recognize that, but also say, there was a Black woman who helped to create this vaccine. So as a community, we know that we have relationship with people, and that people have confidence through relationship and experience, that we have that going for us, and that we should leverage those relationships and the facts, and acknowledging the history and what has happened to move forward to a brighter future, because we know we need us to survive. We need you to survive. Mm-hmm. And we know that this vaccine works. So thank everybody. So thank you to our parents, Shonda and Monique. Thank you to our experts, Dr. Donna Carey and Dr. Oliver Brooks. We had a very informative, a very spirited conversation about increasing confidence in our African-American parents and getting their kids vaccinated against COVID-19. Thank you for your contributions, for your time and your talent.